Well, welcome everyone to Live Better Health and Wellness. I am your host, Pastor Cherise Cross, and we have a great show for you today. We are talking about brain health. I have some guests with us today that are going to give us some great information, and I would love to introduce to you them right now. So here we are. We have Miss Brooks Kinney. She serves as the Vice President of Consumer Engagement and Partnerships of Us Against Alzheimer's. In this role, she leads consumer-facing platforms and strategic cross-cutting partnerships that engage people to advance the organization's mission. She also serves and directs the Women's Leadership Council, a group of women that are spotlighting the disproportionate impact of Alzheimer's disease on women, particularly women of color. Prior to joining Us Against Alzheimer's, she has led national and international public health teams. She has more than 2 decades of experience in health communications and was a caregiver to her mother-in-law who had the disease. I also have with me Dr. Epps, an assistant professor of Emory University, Nell Hopkins Woodruff School of Nursing. Dr. Epps has served as a nurse for over 20 years and served in many clinical and leadership roles in the hospital setting. Dr. Epps has devoted her career as a nurse leader to reducing health disparities for underserved populations through innovative, culturally relevant programs for African American communities. Dr. Epps is also the founder of the Alter Program, the only nurse-led dementia-friendly initiative to support African American congregations. Dr. Epps oversees several faith-based research-related projects and is an active member in several local and regional programs. And to my far right, I have Miss Stephanie Monroe. Stephanie Monroe is Executive Director of African Americans Against Alzheimer's, a network of Us Against Alzheimer's, which is a national advocacy organization based in Washington, D.C. African Americans Against Alzheimer's was founded in 2013 and is the first national network created specifically to respond to Alzheimer's disease disparate impact on African Americans. She is the former Assistant Secretary of Education for Civil Rights. Prior to serving in that position, she ended a 25-year career on Capitol Hill after holding a number of key staff positions in the United States Senate. So I want to welcome all of you to this distinguished panel. You guys are just awesome and you rock. Oh my goodness.
I'm glad to be here.
Thanks for having us.
Thank you for being here. So we are talking about all things brain health, but we're going to be highlighting Alzheimer's. So we want to talk about the fact that it is disproportionately targeting us as African Americans, and that 40% of African Americans are impacted by Alzheimer's. We know that 20 years prior to the diagnosis, there are signs and symptoms that we may not be aware of. And so if we can get prevention versus always being reactionary, I think that's where we want to be, right, Dr. Epps?
Yeah, I agree. And, instead of using the word prevention, I like to say reduce risk.
Oh, wow.
Right?
Yes.
Because there's nothing that has been really said out there that you do this, you totally prevent it. So I just want to be careful because words do matter.
Yes.
And as we talk about words mattering, I also want to speak about, you brought up Alzheimer's disease.
Yeah.
But I just want to make sure that we're clear that Alzheimer's disease is a form of dementia.
Yes, please.
And, you'll see these words used interchangeably, but dementia is a collection of symptoms as it relates to cognitive impairment. And it can be memory loss, problems with judgment, decision-making. So it's various things. And there's over 70 types of dementia. And it's Alzheimer's disease is just one of the most common types. And so that's why we often hear people just say Alzheimer's. So I just want to
Yes.
make sure that we clear that up, because I think knowledge is really key. So
Yes.
we can be aware, because you may hear us say Alzheimer's disease, but your mother might have gotten diagnosed with vascular dementia. So you might be like, oh, but that's not me.
Mm-hmm.
It's all falls under the umbrella of dementia. And so, once we get that clear, now we can talk about the signs and symptoms that maybe we may recognize, and the ways that we can reduce risk.
Oh, that's so good. Thank you for clarifying, because I hear them interchanged a lot. And so I love the even the description of the umbrella being used. And so when we think about just Alzheimer's or even different forms of dementia,
Yes.
basically, what are some myths? I know there are some myths that I've heard, but I would love for you and even Stephanie to kind of share about myths that we believe in the African American community that need to be dispelled.
Yeah, so I think I'll start off, Stephanie, then I'll pass it to you. I know a lot of the work that I'm doing in the community, and just within my own family, one of the biggest myths is that this is normal. This is just part of aging, right?
Yes,
And
yes.
so when your grandmother, your great aunt is 70 and 80, and they're experiencing signs and symptoms of dementia in the family, we just play that to, oh, she's just getting old, leave them alone. Let them stay in the room. But in fact, that is not a normal part of aging. And for us to correct that, yes, every part of our body ages. So our joints age, right? And we cannot get up as quick. And so, of course, our brain will age. But with that, you may not be as sharp where you can recall things as quick, but you will be able to remember them. So instead of you being able to remember something within 30 minutes or something, it may now take you an hour and a half. That's normal part of aging.
Okay.
But not being able to remember, not being able to do other things as it relates to your cognitive status, that's not normal. And so that's one myth that I would love to debunk. Stephanie?
That's so good.
Yeah, I mean, building on that, that's usually the biggest one, that people believe it's normal part of aging. And then we like to call it different things, right? Some people call it sometimes disease. Sometimes I remember, sometimes I don't. So we tend to not think of it as a disease, right? Something that we should actually be asking the doctor about.
Yes.
Because one of the things is that, you may have symptoms of dementia that could be brain changes. It also could be interactions with different type of medications. It could be a UTI, which I don't know if I can mention what that means in common company, but if you want to check back with the church, they'll be happy to tell you what that is. But different things that you should, if you begin to see this series of symptoms and it's ongoing, when you reach the point where you may have forgotten where you put your toothbrush, that's one thing. But if you can't remember what the toothbrush is for, that's a different matter. And so making sure that we call this as a disease, and a disease that actually has some treatments that can help with some of these symptoms, help you to plan as a family. So calling it what it is really important.
Oh, that was good.
That is so good. I thank you for sharing that, because when we don't call it what it is, we're really not personalizing it. We're kind of almost pushing it away. So we're not even accepting that it is. So
And we're
thank you for that.
downplaying it. And so
Yes.
when you're sharing these statistics and
Yes.
the other statistics we're shared today, it doesn't seem as real. And so I really love it. Yeah,
Yes,
let's
call it
call
what
it
it
like,
is.
call it like it is.
I love that. So, Miss Stephanie, can you share about your role with African Americans against Alzheimer's and the work that this network is doing? I think it's so important.
Sure. Well, Us Against Alzheimer's, as was mentioned in the introduction, is a national advocacy organization. It was founded in 2010. And at that point, I was with the organization and began to discover deep health disparities, meaning African Americans are a certain percentage of the population, and you'd expect them to be a similar percentage of those who have a disease. What we found with Alzheimer's is that Blacks were about 13% of the population. But when we looked at the cost of Alzheimer's, we were bearing over 33% of the cost. And we think about, and we talk about, generational wealth, and we talk about being fully employed and all the benefits of civil rights. Well, one, caregiving expenditure that's been put on a family can really wipe out a lot of that generational savings. So we really began to look at these disparities and what's causing these disparities. How much research do we need to do to really understand why are Blacks more likely to get it, or are Blacks just being overcounted? We found that Blacks are twice as likely to get Alzheimer's as non-Hispanic white Americans. And we do need to do more research to understand everything about it, but we do find that a lot of people who are African American who have Alzheimer's also have heart disease and diabetes and cardiac issues and other things that accompany that. So it's important when we talk about heart health and we talk about brain health, because they really are following each other right down this path. So we began to look at that, and I began to do work in the Black community and understand why we weren't having conversations, right? Shame and misinformation and thinking that somehow we were being punished. We often, when we go to church, sometimes pastors will start with, thank God I'm of my right mind. And then if you're not of your right mind, you feel that it's maybe something that you've done. Well, this is not something that you've done, right? This is not any type of a visit on your family because of something that you feel is in your past. This is part of life. It's part of the life course. And as Dr. Epps shared, our brains age like everything else. What we're looking at now is, are there specific strategies that can help mitigate the risk, that can help slow the progression of the disease, and potentially, in some cases, prevent the early onset of Alzheimer's in families. So that's what we're looking at.
I want to ask you, is there a theological claim that comes back repeatedly in your practice of preaching?
For mine is that God is a God of mercy. God is a God of compassion, and that God will never leave you or forsake you. My job is to preach that grace and that compassion and mercy to whomever, comes into church or whoever I contact.
For some viewers, they might not even understand or know what the word kenosis means. Could you please define the word kenosis?
Kenosis is Greek and it means to be emptied out. The meaning of the word is found in Philippians 2:5-7, and it talks about Christ wanting to do the will of God, wanting to do everything that God had called him to do here on earth, but he couldn't do that with his own will. He had to set his own will aside. Every prayer that we pray before we sing, I would like, just empty yourself of everything that you may have been dealing with this week, even this morning, and allow God to take complete control over your life while you're ministering, and allow people to see him.
I love the fact that we're looking at not just brain health, because our brain health is a part of our body still.
Right.
So when you were mentioning that, I was thinking about the disparity of the health system in general. And we saw a lot happen while we were in pandemic when it came to African Americans and the disparity in the health system. What are some ways that we can navigate those barriers when we're looking for care for memory health, and we want to take our family members or ourselves? What are some ways to navigate that?
I can speak from personal experience. When I began working in the Alzheimer's space, my family was relatively healthy as far as what we knew. When my dad began to experience some symptoms, we then began to uncover that there actually had been cases of Alzheimer's that had never been diagnosed or talked about in our family. My dad has had Alzheimer's now for 7 years, and it took us about 5 years to get a good diagnosis.
Wow.
It took
Wow.
us going to the doctor to say, these things are happening, and we were dismissed. Oh, he's just a little old. He probably needs better sleep. Let's set him up with a sleep apnea machine and all of that stuff. And those things may have been absolutely true at the time, but the idea that we were raising a concern that was not being taken seriously, that no one offered to do a memory test for him. No one offered to do a PET scan to actually see whether parts of his brain had atrophied. And so I really strongly believe that it took us about 5 years and fighting and actually changing doctors twice to get a person who was willing to call it what it was. And then we could get him on some medications that were able to help. And we could make decisions as a family in terms of what we needed to do. One of the most costly expenses related to Alzheimer's is not healthcare, it's caregiving. And many of our families, and we certainly hadn't really planned for what we were going to do when my parents got older.
Yeah.
No one up until this generation had ever gone into out-of-home placement, out-of-home care. But the way that we're working now and the distance between ourselves and my parents in terms of being able to be there day to day necessitated that we look for some assistance. They're both my parents, I'm blessed. My mom is 89 and my dad is 86, and they're both doing very well. My dad is, I think, being well monitored. He is progressing, but can still engage in what we call activities of daily living. So he can still brush his teeth. He can still eat without a lot of assistance. I never ask him questions about, do you know who I am? I try not to do that. We take cues from him. We're letting him, be as independent as he can, because I think it's really important, even if something's not being done perfectly, that it be done in a way that preserves that person's dignity. So a lot of times we find, unfortunately, that people may get Alzheimer's disease, and individuals will come in and, take away their right to drive, take away their ability to go to different types of events. They don't want them in restaurants because maybe they're having eating issues and things like that. It's really important that we become a dementia-friendly and a dementia-capable nation, because we know that we are aging and we're also browning. And if Latinos and African Americans are more likely to get Alzheimer's than others, we've got to be prepared for that. And we need to, so you ask what we can do, you've got to call your doctor out. Unfortunately, many doctors are not going to, if they ask you a question, it'll be, how's your memory? Well, you really don't know what you've forgotten.
Right.
So you have to be your own best advocate. I had to ask time and time again for my doctor to take it, what we were seeing on my dad, seriously. And that's what you have to do. And it's okay to do that. You're not being disrespectful. You're demanding the kind of care that your loved one needs. And so I would say be an advocate for yourself and for your loved ones.
Yeah.
Oh, that's so
And
rich.
I would just like to add to that, and I know Brooks can chime in, as we're being advocates and we're encouraging everyone to be advocates for yourself and also for the person you're supporting and assisting, is to bring information to the providers. So if you've been taking a journal of things that you are concerned about yourself or your family member or friend, or even if you took a memory screening at a health fair or something like that, and then we have the brain guide.
That's right.
Right? Even if you took any assessment online or using the brain guide, these are things that I ask that you bring to your provider so they can have something to look at, and that'll be their starting point to do a follow-up of more tests and screenings.
I love that. I love the notion that we are browning and we're aging. I know that our baby boomers, my parents, are the largest generation, or will be the largest one aging at this point. And then we are browning. So I love the strategy of being that advocate. And the starting point can be first to do the assessment. So I love that Brain Guide offers that. And then we could bring that tool as a conversation to our providers. So Brooks, please let us know about this wonderful tool.
Yeah, well,
called
thank
Brain
you
Guide.
again
Thank
so
you.
much for having us.
Yes, indeed.
So I want to circle back to one of the myths
Mhm.
as a way into talking about Brain Guide.
Yes.
You know, a lot of people think that there's nothing you can do
Mm.
if you are diagnosed with dementia.
Mhm.
What people often aren't aware of is that 60% of cases go unrecognized.
Wow.
And when we do diagnose dementia, we often diagnose it really late.
Mhm.
And when we think about cancer,
Yeah.
back in the 60s and 70s, we were diagnosing cancer in stage 3 and 4, and the prognosis is not positive.
Mm.
So when we think about Alzheimer's disease, another myth that I think we need to overcome, and it was really what motivated us to build Brain Guide, was if you have an early diagnosis, you can do things about that, right? There are treatments, there are lifestyle things you can do, support that you can build with your family. And it also provides a lot more independence for the person who's experiencing any kind of memory changes. So we also have to reinforce, I think, in our families and communities, the value of that earlier diagnosis and how much it can bring quality of life to families. And so that was our objective, if you will, when we started thinking about building Brain Guide. So you keep hearing about Brain Guide. Let me tell you what it is. It's a free platform that you can access by visiting a website, mybrainguide.org. You can also call an 800 number. And you can go for yourself. There's a memory questionnaire that you can take just for you if you're worried about your own memory. You go through a series of word tests and questions that we ask you. It's completely anonymous. And then you can also come to the site if you're worried about mom or dad, or if you're worried about your aunt or your uncle, and you see them often enough that you could answer a series of questions about what you've noticed and observed over the last 6 months. So either path you go down, you can visit my Brain Guide, take the memory questionnaire, and here's what we really love. And I actually have to give a shout out to Dr. Epps because she's been part of our medical advisory group, as have many other medical advisors who really helped us build this in a way that was based on science. It's using tools that exist in the clinical setting today. They're just not often used. So we're bringing them into everyone's homes and saying, you can have the ability to do this for yourself in the privacy and safety of your home for either yourself or your loved one. But what's exciting is that once you're done with that memory questionnaire, we provide a summary for you. We explain the results and we let you know it's not a diagnosis, it's just where you are on the scale. And we say, might be time for you to print this and bring it to your family and loved ones or bring it to a healthcare provider. If you don't have a healthcare provider, we have links coming soon that you can find to actually help you find a provider in your area. And we try to give you tips on how to raise the topic. Not everybody has a Stephanie Monroe in their family, and it doesn't always feel easy to raise the topic. So we try to let people know, here are some ways that you can raise it. Here are some ways to ask more questions when you do find yourself in the doctor's office. And we are just having tremendous excitement about this free tool. It's available in English and Spanish. We are partnering with a number of organizations here in Georgia, and we've had over almost 200,000 people across the country take the memory questionnaire. And most are taking it for themselves because we know people have worries and we want them to have a safe place to go.
I love it. I love the fact that you've had over 200,000. How was it here in Atlanta? What's our response been?
Well, in Atlanta, thanks to people like Dr. Epps and our partners at Emory and our partners with you and House of Hope, I mean, we're starting to get the word out through community-based organizations. And Georgia, the state of Georgia, is our #1 state in terms of volume, in terms of how many people have signed up. We're at about 15 to 20,000 people so far in a really short amount of time. And we're doing community events and outreach in the church community to try to really debunk the myths and then give people a tool they can use immediately to check in on their own memory or that of a loved one.
We're talking about purpose today and how to find it, how you get started in it.
Whatever you do, if it doesn't make you happy, then don't do it. But if it really does not make you smile and give you joy in your heart, then find something else.
The faith that I have, if it doesn't work out, I know because God gave it to me, some kind of ram gonna come from somewhere and help me
That's
figure it
right.
out, and it's all going to come full circle.
Dear moms and dads, we know it's not always been easy, and it's been a lot of hard work. What you have achieved here today is going to help us and our futures. It is why we are coming up on stage to collect your diplomas. Everything I do it for you. Mom, love you all. No, it's true. Everything I do it for
When you graduate, they graduate. Visit finishyourdiploma.org to find free and supportive adult education centers near you.
Tell me, what is the role of an economic justice advocate?
We are actually taking that information and finding ways that we can action to help tenants stay in their homes. So whether that means we actually contact their landlord and make an agreement with the landlord, or we actually go to the county or the entity that they've applied for assistance with and ask for the status of the application, what's taking so long, how can we impact the application to make sure that the person receives assistance. Beyond that, we'll continue to fight for that tenant in every way that we can.
I love that we're talking about the awareness because, again, I mentioned earlier that these symptoms, or not even symptoms, but some of the decline can start 20 years.
Right.
So if I'm 60, so if I'm thinking about my parents, they're almost 70, and so 40s. Really, we should be talking about this in our 40s, right?
Yeah, well, even earlier.
Or even
I
earlier.
think you can talk about it even in the in our youth.
Yes.
Right? Because there's a lot of things that we can put in place to reduce our risk and just to be more aware of what's going on. And I always share this. Like you said, symptoms can happen possibly early as 20 years before. A lot of things, when we think about our body and illnesses and conditions, we think about that part of our body, that body system. We don't think about how that system is connected to another body system or another organ. And I think that's a lot of things, especially in my family. I'm just going to talk about me and my family. There's a lot. That's how we look at it, right? If we, we got sugar problems, diabetes, that's it. We're not thinking about how that diabetes can impact our heart. We're not even thinking about how that can also impact our brain. Congestive heart failure, same thing. Oh, I got a bad heart. But while you're saying, quote unquote, you have a bad heart, also there's changes that's going on in your brain that we cannot see, and that's not as visible. And so that's where the 20 years in advance, how these symptoms happen. And, if you're want to just put this out here, if you're diagnosed with any of the heart diseases or any cardiovascular problems, please, take your medications, change any lifestyles, whatever has been recommended, because those are the things that's really impacting us. And for example, I got diagnosed with hypertension. I knew if I did not immediately address that and make some changes in my lifestyle and take my medication, I knew it wasn't just me having maybe some edema in my fluid in my ankle and things like that. And my migraine, it wasn't just that. I knew that if I didn't correct it, other things were actually going to be changing in my brain. And my family would see that, and I would recognize it 10 to 20 years down the line. So that's why it's so important for us to just know about this. And if we have any other chronic health illnesses, to really take care of it and manage it.
And we're so number one in everything. We're number one with heart disease,
Yeah.
diabetes. And so I love the fact that not only manage, but even if we can prevent some of those. So that's why you're saying younger. With our young people, what we're eating and moving and movement and how that helps.
Yeah.
Because we're talking about brain health. And so talk a little bit more about that. Just talk about why it's important outside of getting treated. What are some preventions, if you will, not for dementia or Alzheimer's, but just our health, our brain health? What could we be doing?
So I can start that off because AARP, they have the Global Brain Health Initiative, and they just produced a report that is the 6 pillars of brain health. And some of those, I know I should run them off but sleep is number one. I'm gonna say sleep because a lot of us do not get sleep. And so it is recommended that we can get close to 8, maybe 6 to 8 hours of sleep. That is something that can help reduce your risk, right? It promotes brain health. Eating right. And so I always tell people, there's so many different types of diets, but I have to say, maybe it was in the 90s or early 2000s where they really went hard with the heart healthy diet,
Yes,
right? And just that initiative. Whatever is great for your heart is great for your brain.
That's good.
Right, just period. That is it. So we don't have to look at, we got to do this diet, this diet. What we learned was whatever's great for your heart is great for your brain. So eating right, social engagement is really key, especially during the pandemic. And we're coming out of the pandemic, but it's so important for us to engage with each other. And so those are 3 things. Would y'all like to add before I go on?
Yeah, get moving.
Yes.
And you don't have to do anything fancy. I mean, walking, soup cans with your, doing exercises, anything you can do to move your body on a regular basis is huge. I mean, there's a lot of studies right now that are talking about rigorous exercise that's consistent. And they're saying, 6 days a week, taking 10 or 15-minute walks can make a huge difference on your brain health. And I do want to really emphasize the social engagement because there are a number of new studies that are looking at people being lonely. So even if you are living with family, we all kind of hunker down together, but some of us felt lonely in that experience. And so making sure you look for ways to connect even inside your home, with loved ones, and making sure you're engaging in conversations is really important. Isolation is a big one.
Learning new things.
Oh, I knew there was one more. And look at me, I learned. That was good for my brain. It just popped back.
Learning new things. It's never too late to learn a new skill. Arts and crafts, pottery, playing cards, things that stimulate you, that stimulate your brain to make different connections that hasn't been made. Music. It's interesting because I find that where my dad may not have certain levels of knowledge, there were things that really bring him out and that have been stored in his memory. He was at his independent living place at Christmas time. He was part of a choir and he knew all of the words of all of these Christmas carols that I didn't even know. I couldn't even read and remember them, but it just something that he was reminded of. So to the extent that we can bring out some of the old music and just refresh, right? Sing those songs. And things of that nature. But there's just so much that I'll say this, I think the things that we begin to lose if we develop dementia, things, that may become sort of abnormal are the things that we're really going to cherish. So we often think about Alzheimer's as being memory loss, but it's also sometimes losing the ability to swallow. It's the brain connecting to the food that's in your mouth and telling your throat it needs to open up and swallow. The reason that people sometimes have to lose the ability to drive is because you don't have the fast reflexes that you needed to have or the peripheral vision. I mean, I learned some of this so hard when a couple of years ago I was playing with my dog outside and I took a hard fall, hit the back of my head, had a concussion. And the doctors were able to explain how many things that I took for granted that my brain was doing to enable me just to live a normal life. And so they were like, you can't go on the computer. because your eyes are paying attention to that. It's going to affect your brain. It's going to make your head hurt if you're on the computer for more than 3 or 4 hours a day.
Oh.
You've got to not listen to music while you're driving because you're then processing. I mean, we are using our brain to multi-process.
Yeah.
The brain is a wonderful organ, and it is the engine of our entire body. And when you start to lose the abilities to do some of these things, you learn that those are the things you really need to be doing to sort of protect, right, as protective factors for our brain. And it does start at birth. It starts with, babies being spoken to before they, a lot of people think, why should I be talking to my baby before they can speak back? Well, they are creating a bank of words that when it's there, that's going to do well for them when they age, right?
Yeah.
And so it's, playing instruments. There's so many things that we just take for granted, but those are all things that can help. We believe, we call them protective factors. As you get older and certain things start to change, your body will be able, it's like stored fat. You'll be able to draw on that and those abilities as you begin to age and if you go into dementia. So
it's such a great point. We have a member of our board who was a reporter and prolific writer, and he's pretty far along in the disease, and he still writes. It's like stored up reserve or something, the way he describes it. And so he can still do that activity. And I also just want to reinforce that a lot of those things are much later stage, right? I mean, we have a woman in our story project who she will say to you, if she was sitting on this stage, I was fortunate because I was diagnosed very early when her symptoms were very subtle. And she's lived independently for 7 years.
Oh, wow.
Because she put the things in place and she's moving every day and getting the 8 hours of sleep. So I do want to, it's a long journey. And your journey doesn't have to only be kind of what we oftentimes think about as those end stages of the disease. So I hope that brings some hope to your viewers too. There's a lot you can do.
Just a wealth of information you all have brought. I want to kind of round up or close up this with some resources that you can provide our audience with, either local right here in Georgia, in Atlanta, or even abroad. Let us know where we can find these resources because there's so many, and there's so many things that we can do. I'm excited and hopeful just by the resources that you have shared. So would you let our audience know? And I'll start with you, Miss Stephanie.
Oh boy, there's so much out there. Well,
Yes.
certainly I will say unashamedly that if you went to Us Against Alzheimer's website, you're going to find a lot of great resources.
Absolutely.
And a lot of ways to connect with both Brain Guide and other tools that we've created.
Yes.
The National Institutes on Aging also has a great wealth of resources in terms of diet and exercise and how to engage with your physician and things of that nature. They're colorful pamphlets. They're all free. Your taxpayer dollars have already produced these
All
for you.
right.
So you can go on there and download or just read information. I'll just start with that and let some others chime in.
Yeah, well, I'll add, the Centers for Disease Control and Prevention based here in Atlanta. We run the Center for Health Equity at Us Against Alzheimer's, and they have a tremendous number of resources. We link to a lot of those resources. And I would just encourage folks to check out mybrainguide.org or 855-BRAIN411, because even if you decide not to take the memory questionnaire, you can find resources about risk reduction, screening and detection, how to talk to loved ones. There's also information about clinical trials, prevention trials, lots of information organized, I think, in a way that's pretty easy to navigate. And we tried to make it, easy for people to find whatever information they were looking for along that continuum. So I hope folks find it helpful.
Thank you.
Great. And then some additional resources will be the Alzheimer's Association. Right. There is a chapter here in Georgia, but even the National Alzheimer's Association, it would be very helpful. And then House of Hope is another resource. Being a partner of the Altar program that I run, you can always contact Pastor Cross, and she can get you directed or connected to some additional resources. And then feel free to call me. I am based here in Atlanta out of Emory University, 678-723-8188. But we are here for you.
Well, thank you, ladies. I sure appreciate you coming and sharing this wealth of knowledge. Again, welcome to Atlanta. We can't wait for you to come back. Cannot wait for you to come back, Dr. Epps. You already know you're one of our heroes here at House of Hope. And we thank you again, everyone, for joining. Please share this information, like and share. We know that everyone can use this resource. We hope that you were informed and that you have more knowledge of what's happening. Don't be afraid of words like dementia or Alzheimer's. It's a part of our health, and we can prevent some things. We're not talking about dementia, but we can be healthier. And so let's just work on our health, and that's connected all around. So I just hope that you all got something here today. Please make sure that you like and share this information, and you have all the information here. We'll see you next time. Live better. Live better.